this time about to host a news conference to give an update on Tobago's response to the COVID-19 pandemic. We're bringing you live coverage now on TTT, Talk City 91.1 FM, and TTT Live online.
We are here to chat with you and to share with you and the media what's been taking place over the last week since we were here. The speaker that we'll have today would be Dr. Roxanne Mitchell. She is the General Manager, Primary Care. And then we'll have the Councillor Nadine Stewart Phillips, who is recently on as the Assistant Secretary in the Division of Health, Wellness and Family Development, and Councillor Tracy Davidson Celestine, who is the Secretary for Health, Wellness and Family Development. And they would speak in that order. Good afternoon, and now I introduce you to Dr. Mitchell.
Good afternoon, everyone. Today I'm here to present a summary of our community surveillance activities over the past few weeks, with emphasis on the last week, beginning May 10th to May 16th. With regard to COVID testing, we have done 167 samples thus far, 98 returned negative, 4 positives. We've had 30 rejected swabs and 35 swabs still pending. With regard to general surveillance, as dictated by the guidance from the Ministry of Health, we are required to do 8 to 10 swabs per day as it pertains to general viral surveillance throughout the country. Thus far, we have done 49 swabs, 29 of which have returned negative specifically for COVID, and there are 20 swabs that are pending. As was discussed last week, these swabs are tested at the North Central Regional Health Authority. For the week, May 10th to May 16th, we have done 12 swabs thus far. As indicated before, we need to do 8 to 10 swabs per day. What we are asking now is that persons who present to the health centers and to the Accident and Emergency Department, we are asking that persons come forward for testing and general swabbing. The swabs are not specific for COVID, but for any viral illness that we may have within the community. We are advising persons who have respiratory type symptoms, who have diarrheal type symptoms as well, to come forward to be swabbed so that we could identify the bugs that are causing these illnesses. Swabbings can be done at the Canaan Health Center walk-in, the Scarborough walk-in, and the Roxborough walk-in. We also have persons being swabbed at the Accident and Emergency Department, the Green Room at the Old Scarborough Hospital, and the Delaford Health Center. Please note that swabbing done at the Green Room and the Delaford Health Center are usually swabbed as a result of referrals from the private physicians and from the hotline. Thank you.
Thank you very much. And now, Councillor Nadine.
Thank you very much, Mr. Stewart, members of the media, our listening and viewing audience. A very pleasant good afternoon. It gives me great pleasure to address you in my new capacity as Assistant Secretary at the Division of Health, Wellness and Family Development. I wish to start off by highlighting that I am extremely excited and pleased to be assigned to the division at this time, given the critical role that social services must play at every level as we continue to navigate the effects of the COVID-19 pandemic. The Secretary, Councillor Tracy Devines, and her team of medical officials and staff at the Tobago Regional Health Authority, I know we would agree, have done an exceptional job thus far in ensuring that all the protocols are in place, the necessary actions are implemented at the hospitals and at the various facilities, but more so ensuring that there was no major spread on the island of Tobago to date. However, because of the social and economic consequences, both immediate and long-term, that this public health emergency has on society, and of course here in Tobago, on individuals, on families, we must ensure that we strengthen our social protection responses to mitigate the staggering impacts, and that is the impact that we would feel over time. And so our psychosocial response is critical, and I want you to please note that I said psychosocial, because as much as we are meeting the social needs, there is another element that we cannot forget, and I would speak to that a little later. If I can just highlight quickly, the government has its support measures in place for persons who were retrenched, terminated, or experienced a reduction in income as a result of the COVID-19 pandemic. So we have income support, food support, and rental support. In relation to the rental support, as outlined by the Ministry of Social Development, the processing of applications are ongoing and payments will be made directly to the landlord's account number as provided. However, this process is being derailed due to fraudulent activities. We are aware that no landlord to date in Trinidad or Tobago has received this rental assistance, as there must now be a verification process via site visits to ensure that the information being provided in these applications are indeed accurate. We know that the process is taking longer than it should, but there is a lot of work happening in the background at this time so that the applications can be honored in the shortest time possible. I'm advised that there has been approximately 2,000 applications that were received at the ministry from Tobagonians. From this, 565 applicants were uploaded directly from the Division of Health, Wellness, and Family Development. We are desirous of finding solutions to ensure that this process is fast-tracked. And so on Friday, there was an agreement with the division that we would have access to the ministry's database specifically to treat with those 2,000 applications that were received from Tobago. So the team will go through these applications, disaggregate them, and this will enable us to determine the number of persons who have applied only for rental assistance, only for the salary relief, and only for the social relief assistance. And that would ensure that we take some of the work off of the Ministry of Social Development. So the verification process for the rental assistance for Tobagonians will be done by the division, and of course it will be sent back to the ministry to help accelerate this process. Our most urgent priority at this time is increasing coverage in response to this crisis. And from the division and the Tobago House of Assembly, of course, in discussion with the Secretary Councillor Tracy Davidson Celestine, we have agreed to also provide assistance to persons. To date, the division have assisted 4 families with rent, and those are persons that were affected by the COVID-19 pandemic. The Community Social Services Unit is conducting, as I mentioned earlier, the verification checks for the rental assistance applications. We have over 88 clients that were assisted with emergency food cards across the island of Tobago, and the division has also partnered with the Division of Finance and Economy to access food cards for our clients that are in need. On Friday, 63 of these application forms were submitted to the Division of Finance for processing. The Division of Health, Wellness, and Family Development also provides other relief and emergency assistance, such as our emergency rental assistance and our emergency food support. We understand and know fully well that this is indeed a difficult time. We are aware of the current hardships that are being faced by individuals, and we are really asking for patience. We are asking our landlords to be patient. We are asking our applicants to be patient, because we are working in your best interests. As we work to ensure that we have families equipped to meet the basic needs, or what we call the physiological needs, including food and shelter, we must also ensure that we are protecting the mental, the emotional, and the psychological well-being of our citizens. We understand that staying at home and social distancing and physical distancing may be lonely, but we do not want you to be alone or to feel alone. And so the division has our counseling hotline that is still available. So far, our available counselors have provided support to over 50 persons on the island of Tobago. We have 7 counselors available in Tobago that spans both Tobago East and Tobago West, who can be reached at any time. During this period, but more so after this period, support is needed. And what we want you to understand, what I want you to understand, is that it is okay to not be okay. It is okay to not feel okay. So you can wake up this morning feeling overwhelmed, and that's okay. Families and individuals have been through a lot over the last weeks. I mean, staying at home. You have changed your routines. Some persons have no routines. They stay at home measures, they work from home measures, and so on. And so we are assuring you that we are here for you. Reach out to one of our counselors. You can reach out to me even. I would assist you in the moment and refer you to one of our counselors as they become available. One other area of interest I want to touch on: emerging data worldwide has shown that since the outbreak of COVID-19, reports of violence against women, and particularly domestic violence, have increased in several countries. And that is because of health issues, money worries, security issues, and so on. This has created tension, and the strains, of course, by being in confined spaces due to the lockdown and, in our cases, the stay-at-home measures. If this is happening to you or to anyone that you may know, we are asking that you please contact the police, who will work with us to ensure that we at the division, we have the resources in place to treat with anyone who finds themselves in this situation. Just yesterday, I was reading an article, I think it was an Express article if I'm not mistaken, and Senior Superintendent Sterling of the Tobago Division of the Trinidad and Tobago Police Service revealed that there is an increase in child crimes in Tobago, especially over the last few weeks, which for us is not surprising. A total of 19 crimes, I think he said it was, and so we are urging parents that more so throughout this period, parents, guardians, caregivers, to pay close attention to your children. We are asking that you look for the signs of changes in your charges. And one of the first signs that you can look for is children withdrawing or isolation. One of the other signs that you can look for as well, these kids may start sleeping more. So look for signs that you know are not common in the behavior of your children, because we have a responsibility as the government, as the Tobago House of Assembly, but you also have a responsibility to ensure that your children are protected and supervised throughout this period. And so as I wrap up, I can assure you that our response is a holistic one. We will be tweaking as we go along to ensure that our response is not only effective at this time, but it is a longer term, because I did indicate a little earlier in my presentation that the physical virus may disappear. COVID-19 may disappear, COVID-19 may be no more, but the psychosocial impact of COVID-19 will be around for a very long time. I thank you.
Thank you very much. Councillor Tracy Davidson Celestine.
And thank you very much. Thank you very much, Mr. Stewart, and a pleasant afternoon to the members of the media, as well as to the listening public. I am here to update you on some of the aspects as it relates to our work in the Division of Health, Wellness, and Family Development. Permit me to bring my microphone closer. Yes, some of our work in the Division of Health, Wellness and Family Development. And first and foremost, I would like to start off by indicating that this morning at 10 o'clock, we had a very short ceremony to install the members of the Medical Assistance Review Committee, which will be chaired by one of our doctors in the system, and that is Dr. Maxwell Ayodime. The Medical Assistance Board Committee is aimed at providing financial assistance to vulnerable persons in need of quality health care that is now not available locally. And persons will be submitting applications, that is persons who have no insurance, persons who have quite a number of challenges arising from being medically unfit. One of the things that I have recognized is that quite a lot of the requests for financial assistance coming to the division is as a result of implications having to do with non-communicable diseases. And so the Division of Health and Wellness will work towards ensuring that we can provide access to quality health care for those very vulnerable persons in our society. I want to make the point that there has been quite a lot of negatives arriving from the COVID-19 pandemic. And I, was looking at the particular situation and thinking to myself that there has to be a silver lining behind every dark cloud. And so I've started assessing what can be that silver lining, what can be the opportunities arising from the COVID pandemic. And on evaluating the situation, I have noted quite a lot of things happening within our society and even the world over. When you look at persons throughout Tobago, Trinidad and Tobago, and even in reading different articles, I've observed that there are some commonalities in that persons have started deep reflections in terms of their priorities about their living standards, their quality of lives, the safety of their environments, and the ability to live in very constrained situations. But more than that, I've also observed that quite a lot of us are using the time to learn new skills, so to speak. Some persons I know, they're learning to cook, they're learning to bake. Persons are planting more food in their backyard, and I know that the Tobago House of Assembly, through some respective divisions, have been, giving away seedlings, so to speak. And I also note that persons are using the time to reach out to family members, to reach out to friends who they have not heard from in a very long time. Because, of course, sometimes we get very busy and consumed in our daily lives. And so this time, being at home, not being able to go out to work, is giving us that opportunity to do quite a lot of things and to rekindle some of those relationships that we would have lost over the years. And so I'm hoping that as we look at the opportunities arising as a result of COVID, that they are lasting skills, so to speak. I have observed also that there is a greater appreciation of online programs. There was some time ago where, persons felt that, it was better to sit in classrooms. Online programs now allow for more time with family at home, and I know quite a lot of persons have been accessing online programs going forward. Even the acceptance of Bible study. Persons have said to me from within the churches, even Dr. Mitchell, who is here on my left-hand side, would have indicated that in the past, 12 and 13 persons were subscribing to their Bible study program. Now that persons have more time at home, she has seen, and others have reported, an increase in the number of persons accessing Bible study online. One of the things I hope to come out from this particular situation is that, legislation can be looked at, and the situation can spawn new legislation in the area of allowing for working from home. I have seen where we have now pandemic leave approved by Parliament, and I'm hoping that going forward, legislation can happen with regards to allowing persons to work from home, which of course gives more time for the family. I've also been looking at our systems within the Tobago House of Assembly, and in particular, the Division of Health, Wellness and Family Development. And I've looked at whether our system has improved as a result of the pandemic that we face, the COVID pandemic. And I've reasoned, along with talking to others who are part of the health system, that our systems have become stronger, and they are even more, and we are using this period to create greater strategic opportunities on behalf not only of the THA, but the Division of Health, Wellness and Family Development. And so far, we have used the challenge to leverage technology to trace and quarantine sick people. We have used this period to pay for suppliers for goods and services, thereby strengthening our relationship with those persons. We have used this period to create and employ additional nurses and doctors within the system so that we are able to administer services to our clients with more prudence and to be more effective and efficient going forward. We have treated with the outstanding issues having to do with the laboratory at the hospital so that we are now able to offer laboratory service as well to our clientele. We have added additional ventilators as well, and I would have communicated to you that within recent times we would have received 4 ventilators. But more than that, we have improved our testing capabilities by procuring a PCR machine which provides testing not only for COVID, but for infectious diseases as well. And when I speak of infectious diseases, I'm talking about tuberculosis, I'm talking about HIV, AIDS, as well as other noted infectious diseases. One of the things I really appreciate coming out from this particular instance is that we have also looked at community surveillance, and Dr. Mitchell would have indicated that in her presentation, and we spoke about it on several occasions. And so community surveillance now affords us the opportunity to talk, to reach out to quite a number of persons within the communities and to get a better understanding of what is going on within the respective communities. And as has been said earlier, we are not only looking to test persons for COVID, but we are looking to test persons to see and to get better and more predictable information as to what is going on within our respective communities. And of course, that information we can use to shape policy going forward as it relates to health and health care for us in Tobago. One of the things I must add is that in terms of the PCR machine, that machine was installed, and the training for 4 lab technicians was also completed, and all protocols for use of the machine has been sorted and are now in line with national standard. And I would expect that, testing would start this week as it relates to testing for COVID, tuberculosis, and HIV/AIDS going forward. Another aspect that I wish to mention is that our air condition units, and I spoke about how we have been improving and strengthening the system as a result of COVID and looking at the silver lining in all of this situation that we face. I have been advised by the chairman, by the chair lady of the board, that tendering is taking place as we speak, and that by the end of the month we can expect to see work taking place at the Scarborough General Hospital as it relates to resolving the issues surrounding the air condition at that facility. We also have some challenges at the Scarborough Health Center as well with regards to the air conditioning unit. Those units have already been procured, and we will work towards installing them within the shortest possible time frame. Last but by no means least is the gratuity payments. Those are ongoing, as I would have indicated to you, the members of the public, the members of the media. Gratuity payments have in fact started, and the TRHA has indicated to me that over 200 persons to date have received a payment. But bearing in mind, well, I must indicate that only those persons who have since been approved by the Board of Inland Revenue have since received payments of gratuity to date. So, in terms of my presentation, I am of the view that although we have quite a lot of challenges arising as a result of the COVID pandemic, there is a silver lining behind every dark cloud. We have to look to see what opportunities can be had from COVID. Persons are learning skills in a number of different areas. People are more accepted, more appreciating of online programs, Bible study, taking time out to treat with their family. And more so, our health system is growing stronger as a result of the particular issues that continue to face us at this moment.
Thank you very much, Secretary. And now we open it up for the media to ask the questions. I would remind you that you are to put up your virtual hand. We will see it, and then we'll call you in the order that we see it appearing. When you get through, we ask you to please mute any other device beside the device that you'll be speaking to us on, because that would create a delay and sometimes a feedback. We ask you to restrict your questions to 3 short questions so that the audience, the panelists could respond. And if a question has been asked before, please forego it if it has been passed already. And please keep the questions on COVID-19, Tobago's activities and response. First person to be acknowledged would be I-95.5 Whitfield Turner.
Whitfield Turner from I-95.5. Begin in reverse order, since Mrs. Davidson Celestine would have touched on these couple issues later down in her presentation. With respect to the issue of gratuity, is there a time frame that the division is working with to say maybe in the next 2 months, 6 months or so, we should be able to have all outstanding gratuity payments made? Also, with respect to the lab, I know you mentioned the commencement of testing. Last week you said it will commence this week. Are we in a position now to have a firm date as to what day this week the tests will commence? And my other question for now for Councillor Nadine Stewart Phillip, as you come into this new division, what do you see as your specific role, especially as it pertains to COVID, with your educational background? Is it that you will be dealing more with the psychosocial aspects, and Councillor Davidson Celestine will be dealing with the more biological aspects of it? How is that going to work?
Okay, so let's take the first one first, gratuity, the time frame for that.
With regards to the gratuity, of course, we cannot pay until the time that we have received Board of Inland Revenue approval. And so once that is had and we have the funding, we will pay the gratuity going forward. So I can't establish a timeline, but it has to do with the information coming back from the Board of Inland Revenue.
Lab, as to when the testing would actually begin.
I can't issue yet a date for the start of the testing. All of the equipment has been installed. The training has taken place. We have one minor challenge where we did not receive the swabs, the test kits rather, with the machine. Those are coming in from Guyana. I am told that They were sent by FedEx and will arrive in Tobago by this week. And so once as that is received, all will be well, and we will start testing here in Tobago. So we expect that before the end of the week, testing should begin. If not this week, very early next week.
Councillor Stuart Phillips, is it psychosocial? Is your portfolio?
Thank you very much, Whitfield. In discussion and as agreed with the Secretary of Health, Wellness and Family Development, the Secretary's focus will be on health, and the TRHA and my focus would be on wellness and family development. Right now, the focus, as I indicated, is on our psychosocial response to COVID-19, but there are other elements that we would also get on stream as we go along.
Elizabeth Williams, TV6.
Hi, good afternoon to the panel. Good afternoon, everyone. Good afternoon. Elizabeth Williams, TV6. One of my questions include, I know that someone would have died on the 13th of May from tuberculosis and other complications, medical complications. Is it that we have an outbreak of tuberculosis in Tobago? And what recommendations do you want to tell persons at this time? We are hearing that in terms of the death of this person, some medical personnel at the morgue were not aware of this death. My other question is, I know Mrs. Nadine Stuart Phillips would have mentioned it with respect to rental payments, etc., to Tobagonians, and fast tracking of this is going to be done. What advice do you give to one person who would have reached out to me and told me that her employer is refusing to provide her with a letter stating that she was employed at a particular establishment? Also, NIS payments were not made. And at this time, she was told by the division that she would not be able to submit the forms because she does not have the letter from the employer. And I know Health Secretary Tracy Davidson Celestin would have indicated or mentioned, the issue of public health inspectors. I'm not sure if it has started since we are going into the rainy season. If public health inspectors have started checking on drains in need of being cleaned in various communities throughout Tobago.
Thank you very much.
With regard to the question of outbreak of tuberculosis, over the past few years, we have been treating persons with tuberculosis within the communities. However, our numbers have always been low. The death of one person from tuberculosis does not necessarily indicate that we have higher numbers or increase. I am not aware of the circumstances surrounding the death of this individual, but a number of things can come into play. In general, however, keep in mind that COVID has us inside. Most persons are within a closed setting, and persons need to ensure that they open up their homes, that they ventilate the areas. Persons need to ensure that even within their workspaces, that they have sufficient ventilation within those areas. Transmission of infections such as tuberculosis will take place in places that are not well ventilated. So my caution with regard to COVID-19 and diseases such as tuberculosis would be to ensure that your home space, your living space, your workspaces are well ventilated. And just to reiterate, with regard to the person you were mentioning that would have died on May 13th, I am not sure in terms of the specifics as to why this person would have died, but it does not necessarily indicate that there is an outbreak of tuberculosis on the island.
Yes. NIS refusal of letters from landlords.
Thank you very much, Elizabeth Williams, for your question. Again, it is extremely unfortunate that to date and at this time, employers are still refusing to sign the forms of your employees. And so we are asking that a report be made to the Department of Labor at the Division of Community Development, Enterprise Development and Labor.
You had addressed the cleaning of drains, Dr. Mitchell.
With regard to the cleaning of drains, the public health inspectors will do their necessary rounds as we enter the rainy season. You would recall that last week I would have asked the population, or at least cautioned the population with regard to ensuring that the drains around their homes, that things like their roofs are cleaned and everything is in place. If there is a drain in your area that is backed up, that you know water is not passing through, my advice would be to call the Public Health Inspectorate to ensure that they can come, do the necessary inspections, and the information can be passed on to the relevant authorities with regard to clearing those areas, because we are aware that once the rains begin to fall and there's no way to go, water will always cut its own course. With that in mind, we are to also prepare for things like the ITCZs that will be passing and also bringing with them a lot of rain. We do not necessarily need a storm or a hurricane to cause flooding, but just the increase in rain for the rainy season will also bring about that type of event. So you are cautioned and you are asked to ensure that the drains around your homes are clear. You are also cautioned and asked to ensure that things like your roof are in place moving forward.
Thank you very much. 91.9 FM, Vern Extravor.
Hello, good afternoon, panel. Vern Extravor, 91.9. Just a couple quick questions. To the Assistant Secretary, now that you've stepped into the role there, the Division of Health, Wellness and Family Development, have you been able to take a look at the psychosocial response so far, considering we only had 50 callers to the line? Is there anything that you would like to do in terms of ramping up the psychosocial response to COVID-19? If you could give us some insight into that. And I'm not sure if the Secretary will be able to give us some feedback, but we are approaching a year since the sword was turned on the Roxborough Hospital. So I wanted to know if there are any plans in there and if the Roxborough Hospital may have been one of the things that might have fallen victim to projects that may be shelved, as quoted by the Chief Secretary. And back to the Assistant Secretary, I know you had noted that 88 applications were received and 63 were sent to finance for processing. Did I get that correct? If I could just get some update on the 25 outstanding, is it that they just need to be processed by you all to go forward, or is it that you all have found some fraud or anything that's questionable in those? Thanks.
Well, we'll start with that last question first.
The first question?
The one that he just referred to as whether it was fraud that was keeping it back. Okay, we'll go with the psychosocial. Your thoughts on it?
Okay, thank you very much, Vern. As I mentioned, today is my first official day on the job. I did visit the division on Friday and had a brief discussion with the administrator and, of course, the Secretary of Health, Wellness and Family Development. As at present, the focus is on providing counseling services, dealing with the psychological response, and then we have the food support and hampers, etc., on the social side of it. The intention is to meet with the various heads of department between this afternoon and tomorrow, because we must strengthen our psychological response, because I don't think that we have placed enough focus on the psychological aspect of the response to COVID-19. So I would be looking at that over the next few days.
Thank you. Roxborough Hospital, 1 year now. When is it due to come on stream?
I wish to indicate that the Roxborough Hospital construction is ongoing at this time, and I would have reported in one of our press conferences that we expect a completed facility by September of this year. I know that the contractors are working very hard to bring home the project in the shortest possible time frame, and I have met since with the members of staff of some of the members of staff of the TRHA board, as well as some of the doctors, to work out the commissioning plan to get the hospital up and ready as soon as it is handed over by UDCOT. And so all of the plans are ongoing, and we expect to receive that facility this year.
Okay. And I wasn't too clear on the third question from Mr. Extravor about that the information that went to Trinidad as to why they may not have gone 25. What was that referring to? Okay, so Mr. Extravor, we will have to bring you back in to get that third question.
Yes, all right. I was referring to Councillor Stuart Phillips had mentioned that 88 applications for relief were received by the division, and that 63 of those have since been passed to the Division of Finance for processing. So there were 25 outstanding, and that's what I found about those other 25.
No, I think what I indicated is that 88 were sent, and on Friday, just for clarity.
Okay, thank you very much. We go now to Clayton Clark. Yes, okay. So we still trying to get Clayton Clark. So do we go back now to Elizabeth? No, we haven't seen Cassandra Thompson Forbes. Yes.
Good afternoon to the panel. Are you all hearing me?
Yes, please.
Okay, so my first question, this is for Secretary Tracy Davidson Celestin. We just celebrated Nurses Week, and in these times, our nurses are going above and beyond the call of duty. Can you tell us what did your division do to recognize them or appreciate them in for Nurses Week? And if not, why, and do you intend to? My second question, the government has started the phased reopening. Some of the people who were on the breadline has restarted to work. Are they still eligible for the various social assistance grants? And what sifting process are you all using to separate those who may no longer need the assistance that they might have registered for? And my third question, I know you said investigations will be launched into instances of fraud with persons who are submitting fake documents to the division for the grants. Have you all found any improprieties thus far? Thank you.
Okay, so we start with the Nurses Week. Was there anything done, and is there anything in mind to do for the nurses?
Thank you very much for that question. I want to say that we are focused on creating a very comfortable working environment for the nurses as well as all our healthcare practitioners at this point in time. And so since I've come into the Division of Health, Wellness and Family Development, I have been focused on how I can treat with those long outstanding issues within the shortest possible time frame. So what we have done to date is to ensure that we can give the nurses their outstanding gratuity, as well as other members who are employed in the TRHA and who have not received their gratuity for quite some time. And based on the information I've received from the chair lady of the TRHA, almost 200 persons have been paid to date, and we have spent quite a lot of money to ensure that they have received those gratuity. We have also been working on ensuring that we treat with the hot water at the hospital. That was down for quite some time, and it is now installed and up and running. So all of the hospital now has hot water. There was a request to ensure that the closets, the lockers, and those kind of things as it pertains to nurses who operate at that facility is also being dealt with. And we have caused the population of Tobago and even Trinidad and Tobago to recognize nurses as well as all health practitioners for the work that they have been doing, not only with COVID, but for standing guard and ensuring that we are safe and that we have a very effective and efficient healthcare service on this island. The recognition of nurses continue. It is a long 1 month of activities. The chair lady and I have started discussions with a view to adding additional incentives. I am to do a video recognizing all nurses, and we will be distributing tokens throughout the length and breadth of the island to all nurses. But the point I want to make, in essence, is that nurses continue to be recognized by the Division of Health, Wellness, and Family Development, and all health practitioners and workers of the division continue to receive recognition and high praise. And I will work towards ensuring that we have a very comfortable environment for all who are employed within the division.
Right. And I think that Cassandra had also asked about whether there is detection of fraud and what will be done.
No, there is no detection of any fraud at this point in time.
All right. Eligibility of social services assistance for those who have returned to work.
Okay, thank you very much, Cassandra. As you are aware, the government did indicate that the period would run from persons that lost their jobs. I think it was from either March or April. So even if those persons might have returned to work in the middle of May, I am very sure that those applications will still be honored. But of course, we will have that discussion with the Ministry of Social Development, because although you have restarted employment in the middle of May, I'm not sure that they would be paid at the end of the month. So it's a conversation that we would have with the Ministry of Social Development.
All right. Akinlabi Holder, Tobago Channel 5.
Yes, good afternoon. Are you hearing me?
Yes, sir.
Okay, so I have a couple of questions for the secretaries, Davidson Celestin and Lady Stewart Phillips. But first, I'll start off with Secretary Lady Stewart Phillips. Or if she can't answer, because this is her first day, maybe Secretary Davidson Celestin can answer. But what is the process for area reps and secretaries to distribute food cards? And the reason I'm asking that is because this morning on Rise and Shine, area representative Shalon Cunningham would have complained about an unknown high-ranking THA official going through his area, his constituency, and randomly handing out food cards without going through the proper process. So my question is, how is that possible? What is the process and how is that possible? And what are the checks and balances you all have on that kind of thing taking place?
Is it that you only have one question?
Oh no, the rest of the questions are posed to Ms. Stewart Phillips in the next one.
I thought it was 3.
Okay.
Thank you, Akinlabi. As far as I am aware, the distribution of food cards is being facilitated by the Division of Finance and Economy. If assemblymen or councillors are indeed in receipt of food cards, it is because these assemblymen and councillors are assisting their various electorates and constituents by filling the forms out, ensuring that they get to the Division of Finance, and then we can say to the Division of Finance to ensure that we limit the amount of persons that come to the Division of Finance. I submitted this batch of forms, so can I please have those food cards and I would get them back to the persons. As far as I am aware, that is the process that takes place. It is facilitated primarily through the Division of Finance and Economy.
Clayton Clark, Radio Tambourine.
Are you hearing me now? Good afternoon.
Yes, sir.
Yes, good afternoon to the panel. Couple of questions. Just want to get an update on a matter I raised earlier. Two things. One, an update on the whitewash collection.
White waste?
The white waste, sorry, collection. Is it still going on? There were some delays that you all announced. Secondly, the Secretary Davison Celestine, you mentioned before that some health officials will visit the residents at Signal Hill who are being affected by the smoke at the incinerator. I want to get an update on that. And that's it for now.
Thank you. White waste, Dr. Mitchell?
With respect to the white waste collection, they have been collecting. I know I had one concern with regard to the Mount Mary area as I traverse there to get to work on a daily basis, and they have collected. They're also collected in some other areas. If within your area you're still seeing waste on the side of the road, my advice would be to call the public health unit to ensure that they do the necessary collections within your area.
The incinerator?
Well, I would add that work is ongoing with regards to the incinerator. Some discussions were had, and we now look forward to establishing or installing rather the microwave unit. So those discussions are ongoing.
Vincent, Guardian Media. I'm not sure if it's Lois Vincent. Okay, no. All right. So let's go to, we'll need to return then to 995.5 with Will Turner.
Yes, thank you very much. Just to continue, Secretary Davidson Celestine this morning at the MOH presser, the Minister of Health would have announced that 50 students will be called upon to assist with the CMOs in terms of ensuring that public health regulations would be enforced at the various business places. I don't know if Tobago would have submitted a request for any of those persons. How many persons do you think we would need, and how soon we might be able to get them? Also, can you tell us how many ambulances are currently on the road at this time, as well as the opening date for the Moriah Health Center, and a request from persons in receipt of the emergency food cards? They'd like to have a list of the business places that are accepting those food cards, because apparently some of them would have gone to certain places and they were turned away. So they'd like to have a list so that they know exactly where they can go, so as to minimize their time outdoors, minimize the level of exposure, so that they can stay home and stay safe.
All right, so 50 students, are we getting any in Tobago?
Let me add that we have deployed members of staff from within and throughout the division to assist in our community surveillance program for quite some time now. We have a graduate trainee program. We have short-term staff within the division, and we took the decision probably over a month or 2 months now to redeploy those staff to assist out in the communities. And so for us, that is ongoing as we speak.
Emergency food card.
With regard to the ambulance services, we have 7 ambulances in circulation. As was mentioned before, we would have outfitted one of the ambulances specifically to deal with the transportation of COVID suspect persons and COVID positive persons. We have another ambulance that will be on standby in the event that they need backup with regard to that. But we do have 7 ambulances in circulation at present. As it regards the Moriah facility, we are expected to have a handover from UDCOT at the end of July, all things being equal. Services are ready to start. We have our staff in place, and we will continue to train so that once the building is turned over, we would have the commissioning and the opening of that facility, hopefully within the first couple of weeks of August.
And just to add in terms of the ambulances, we have a decentralized approach to servicing, and so you would find at least one ambulance is in different parts of Tobago. We have one in Palatavere, Dullaford, Charlottesville, so to speak. So they are throughout the length and breadth of the island, or located throughout the length and breadth of the island.
Akin Lobby Holder.
Yes, good afternoon again. Secretary Stuart Phillips, I just want to ask you, how would you have rated your performance at the Division of Tourism? And why will you give yourself that rating, and how can you bring your strengths to bear on your new assignment?
Akinlabi, thank you very much. I am pleased with my progress that I made at the Division of Tourism, Culture and Transportation for the 3-year period that I spent there. There are some notable achievements that I know that the media are already aware of in both the areas of tourism and culture. As we go forward, I have the utmost confidence in the capacity and capability of the Honorable Chief Secretary, who also has responsibility for that division in ensuring that Tobago continues to go beyond ordinary. Moving to health, wellness, and family development, as I indicated before, I was very excited for this move. A lot of persons are seeing this move as a demotion for whatever reason. But personally, and if you understand that my training and experience is in social service delivery, psychology, counseling, etc., you would understand that my experience and training is required at this time. As I indicated, the secretary and her team of medical officials, they have done well with the response to COVID-19 on the health side. And so I would ensure that the psychosocial response from the wellness and family development side is also very effective, because as I also said in my introduction, COVID is going to disappear, the virus may disappear, but the psychosocial impact is going to remain for a very long time.
Elizabeth Williams, TV6.
Before Miss Liz Williams, to respond to one of the questions you asked earlier, the list of businesses or supermarkets participating in the food card program is listed in the package that is given to each recipient, but more so, there are 3 establishments that are on the program now: Penny Savers, Viewport, and cost cutters. And one of the things we discussed at one of our exec council meetings is to expand the number of businesses in the program so that we can have a wider representation.
Thank you. Elizabeth Williams.
Good afternoon again, Elizabeth Williams, TV6 News. I just wanted to get from Dr. Mitchell the number for public health, because I am aware of some drains that need some cleaning and I would like to make some calls. So if you can give us the numbers that we can call to get these drains cleaned.
63915. Ms. Williams, we'll have to get back to you with regard to the direct line for the public health unit. We'll give it to you before the presentation is done.
They didn't want 6391433, I think it is.
Sorry?
I think it is 6391433.
It's 1433, okay.
I think that's the number.
All right, so I'm now hearing 6391433. And the office of the CMOH as well is 6393751, so you can make your call accordingly.
Okay. Clayton Clark. Clayton Clark, Radio Tambourine. All right, so let's move on. There's a question coming in to the Assistant Secretary, following up on Liz's question about employers not wanting to sign the assistant form What can the Division of Labor do in cases where employers do not want to sign these forms, and are they guilty of any offense? This is from Newsday, Kenisha George.
Well, I cannot speak specifically to the operations at the Department of Labor, but I am pretty sure that question can be directed to the secretary or the relevant officer. But we were informed that persons should make their what's the word?
Their submissions.
Their submissions, sorry, to the Department of Labor.
Thank you very much. Yes, let's go now to Clayton Clark.
Yes, good afternoon again. Two questions. Secretary Davison Celestine, I don't know if I didn't ask my question properly or directly. You said previously you're going to send officials to visit the residents and to assess their complaints. I didn't hear you respond to that question, so I'm asking it directly now. Have officials been dispatched? Have you all visited the residents at Signal Hill? And the second question, we on the media, we heard this morning about that Magdalena is still operating. Is it that all guest houses and hotels on the islands have been closed because of the coronavirus? I have confirmation that persons have been staying there. So I just want to get an update on what is happening with Magdalena and as opposed to the other hotels. Is it hotels are closed?
Well, I'm not too sure we have somebody on the panel who would be able to address that. The tourism, the CEO might have been able to, anybody, or that we pass on that.
What I can say, Clayton, is that some of the hotels and guest houses, because there were some visitors before the COVID-19 pandemic that were not able to get on those repatriation flights and so on, they would be at some of these hotels and guest houses. I cannot give the names. I cannot say what are the names of the hotels or guest houses, but I know that there were some persons still on the island and they had to be accommodated at the hotels and the guest houses.
Okay, so the next person.
Yes, and I would respond again to indicate that the process is ongoing. That is the process of discussions and bringing the situation to a close. That is ongoing as we speak. And all information has been communicated to the public health officials, to the administrator, TRHA, and they are rolling out their plan of action.
All right, so are we back to Whitfield Turner now? I-95.5 FM.
Yes, just wanted to get it clear from Secretary Davidson Celestine. So is it that we have enough boots on the ground now to do the monitoring and so forth, so we won't be requiring any additional persons to come in to assist the CMO? Just wanted to get that part clear. And also concerning the Magdalena issue, we were informed that there was an issue on the port on Sunday morning where apparently some persons might have been left behind. And the information that we were getting thus far is that persons were actually traveling between the islands on holiday. And apparently some of them would have come to Tobago, would have stayed in different places. And in trying to return to Trinidad, they were told there was no more room on the vessel. And therefore, they were then pretty much left out in the cold. And the name Magdalena was raised in that conversation. So if anyone might be able to look into that or provide any sort of feedback in that regard. But definitely, do we have enough boots on the ground to continue the monitoring along with the CMO?
All right, so we'll raise the one with the monitoring that you raised. The one concerning the hotel, we do not have on the panel here today someone who would be able to speak to the issue that we have there raised here. But do we have enough boots on the ground as it stands?
At this point, there is no request from the CMOH for any additional support in terms of treating with the community surveillance. If a request comes forward, we try to deal with it as soon as is possible. in addition to the work that the Office of the CMOH is doing, we also utilizing the health centers as well. And Dr. Mitchell would have spoken, I think if not in this press conference, in the last one, about us utilizing 7 health centers to treat with community surveillance. So in addition to what Dr. Hoyt and her team is doing, we are complementing that service with Dr. Mitchell and her team and utilizing health centers.
Okay.
If I can just expand on that, please. With regard to boots on the ground, at present, the CMOH office does have staff. If we need to expand, we do have officers such as our audio and visual screeners who usually go to the schools to do the auditory and the visual screening in our entrance and leavers. They have also been trained with regard to contact tracing, with regard to some aspects of surveillance. They can be added to that complement of staff. We also have some nursing students that are back on the island as well, and they have also been trained accordingly, and they can also expand the staffing accordingly.
Thank you very much. Okay, and I just want to go to Councillor Nadine Stewart Phillips, so just give a clarification on a previous question.
Yes, I just received a WhatsApp message from the administrator, and that is in direct response to Elizabeth Williams' question. If there are employees where your employer refuses to sign your form, we are asking that a recommender who can verify your employment, that would be accepted. Once you can identify a recommender that can verify your employment, the form will be accepted.
Okay, thank you very much. We go now to Akinlabi Holder, Tobago Channel 5.
Yes, one question. Yes, one question for Secretary Stuart Phillips and one question for Secretary Davidson Celestin. Secretary Stuart Phillips, one last question concerning your tenure at the division. What would you say would have been any shortcomings during your time there, and how do you seek to make those amends and contribute towards your new position? And Secretary Davidson Celestin, this morning in the Ministry of Health press briefing, they have spoken about the homeless and the facilities they have to take them in during this time. What exactly is the THA doing? We have similar facilities and we made similar preparations for the homeless here.
Can you repeat the question because I didn't hear it? What is the oversizing?
Yes.
Hello, you heard me?
Yes, could you ask it again, please?
Yes, I was asking what exactly is the division's plan, or have you all made any plans to facilitate the homeless, take them off the streets and that kind of thing during these COVID times?
Thank you, Akinlabi Holder, for your question. In response to your question, what I would say to you is I have now entered a new role and a new capacity, and therefore I would ensure that I work with the secretary, with the administrator, and with the team at the Division of Health, Wellness, and Family Development. Speaking about my shortcomings at tourism, I'm not sure it would make a difference. No.
Next question, Cassandra Thompson Forbes.
Homeless.
The homeless, yes.
Mental health.
With regard to the homeless situation, our mental health services are available. I do know of a number of persons who are regarded as homeless that do attend clinics. We do have assistance with regard to whether it be food vouchers, whether or not it be assistance for persons to stay. We do have those in the making as well. If there are persons who find themselves homeless, they can submit their names, all right, to any one of the health centers or to any of the division's facilities, and we will assist as much as we can as it regards food and as it regards rent. In the interim, like I said, mental health clinics, we have at the hospital, we have at Scarborough Health Center, Mason Hall Health Center, and the Roxborough Health Center. Persons can also seek assistance there.
Okay, so we've covered all right. So I think the final two persons is Cassandra Thompson Forbes and then Whitfield Turner, and then we close it off there.
Good afternoon again to the panel. In these times, there are several persons and brands offering hand sanitizers for sale. And some of them are proving not to be so potent after you purchase them. Can Dr. Mitchell, especially, can you tell the public if there are anything specific that people could look for on the labels to determine if they purchase this item or not?
All right, from the beginning, we did say that persons should use soap and water with regard to the sanitization and cleaning of their hands. We also advise that if soap and water is not readily available, you should use an alcohol-based hand sanitizer. Specifically, what you're looking for is anything that has 70% alcohol, and the alcohol there is supposed to be isopropyl alcohol, and I've heard of other types of alcohols being used, but you're looking for 70% isopropyl alcohol within the formulation. I am also aware that there are a number of products that have the different scents, the smells, and stuff like that. Even when you go to some of the workplaces, you have those that have the residue on your hands. Again, check and make certain that you have within that particular formulation at least 70% isopropyl alcohol moving forward.
Thank you very much. Cassandra Thompson Forbes, I think it's the last. Who did? Or we don't have any more questions? Whitfield Turner.
Yes, we do.
Yes.
Yes. My final batch of questions. I don't know who would be able to answer these questions. Is there a reason why we're not seeing surveillance testing being conducted at more medical facilities in Tobago? And also, if you can state how many persons would have engaged in contact tracing for the positive persons that we would have identified. And finally, we haven't seen the CMO at these processes for a while. Is there anyone who can fill in for her when she's unavailable, or is it that Dr. Mitchell will fill those shoes for her?
Well, we'll take it immediately to Dr. Mitchell.
So with regard to the medical facilities, the way the primary care system operates is that we are divided into clusters. We have 4 clusters. Within each cluster, each cluster, we have a main facility. The main facility will have clinics happening on a daily basis. And the main facilities would be Scarborough, Canaan, and Roxborough Health Centers. And with each of these, you have the walk-ins. So that traditionally, community surveillance would have taken place at the walk-ins because there are doctors present on the site every single day. Within the clusters themselves, you'd find that the doctors assigned will rotate among 3 or sometimes 4 facilities. The swabbing that is required for community surveillance is usually done by a physician. And if there isn't a physician present, you should not ideally do the swabbing. All right, so that as we try to ramp up community surveillance, we keep in mind that a facility may not have a physician attached to it every single day, and that may hinder the number of swabs we are able to collect on any specific day. But we are working on that. As it regards the contact tracing, we are doing the contact tracing for primary and secondary contacts. We have completed, as far as I'm aware, the majority of contact tracing for persons, and we have now moved beyond simply contact tracing to community surveillance. This is just another step in our move towards protecting the community and trying to contain the virus in terms of spreading. As we would have learned in the beginning, the phases would have been the alert phase, which we are out of, the containment phase, which would have involved our quarantine and the contact tracing drive, and we're now into mitigation, overlapping, of course, with containment. So with that, we are now into the community surveillance phase of our response. And as we move forward, you would find that other facilities, not just the walk-ins, not just the accident and emergency department, and also not just the green room and the Delaford Health Center, but other facilities in their routine duties will increase the number of swabs that they actually take.
Thank you very much. And that brings us down to the end of the program. I want to just give it over to the Secretary for any final words, and then we say our thank yous.
Well, again, thank you, Mr. Stewart, and thank you to the panelists today, to the members of the media for helping us to share the information re-COVID and what we are doing to impact the lives of the people out there in Tobago. I want to use this opportunity again to remind persons that the reopening of Tobago and Trinidad and Tobago is on a phased basis, and that we are working collaboratively with central government. But in reopening, we also have to continue to practice the rules and regulations as it pertains to the new normal. And we all know what those rules and regulations are. And so I'm continuing to encourage you, the members of the population, to follow the respective habits. And as I said, the information is ongoing in terms of how we share it, whether it be via social media or the print media, so to speak. So practice those rules and meet at the level of the COVID task force. We try to meet at least 3 times per week, which is on days and on Sundays as well, so that we can continue the process of planning. As I would have indicated some time ago, we have added additional support to the team to help us to ensure that we cross all the T's and dot all the I's in going forward. Greater monitoring and evaluation in terms of the task that is in. Most importantly, we continue to prepare, we continue to that our facilities are in good order so that we can treat with any effects. But outside of COVID, we are strengthening our systems to provide better health care for the members of the population and our clientele. We have over 30,000 persons who utilize our health facilities, whether it be the health centers or the Scarborough General Hospital, and we will continue to ensure that we have effective systems going forward. And so that is a work in progress from all of us. I want to take this opportunity to welcome publicly our new Assistant Secretary to the Division of Health, Wellness and Family Development, Councillor Nadine Stewart-Phillip, and both of us will set the policy and ensure that the administrator and members of staff are given the resources to implement and give effect to the policies going forward as it relates to the work of the Division of Health, Wellness and Family Development. And so we are both very committed to the exercise, and we have been receiving the support and the commitment from the members of staff going forward.
And thank you very much. And I want to thank all those on the panel this afternoon, the Dr. Roxanne Mitchell, also Councillor Nadine Stewart-Phillips, and Councillor Tracy Davidson Celestine. I want to thank you also, all the members of the media, for being here and for the question that you have asked and the promotion of the information that you will so do. I want to also thank the persons who have been doing the sign language. We really appreciate your support and your help in this wise. The members of the Tobago Regional Health Authority who have been working so hard, the Division of Health, Wellness and Family Development, and of course generally the Tobago House of Assembly. Until next week when we'll have another press briefing, I wish you all the best. Good day from Tobago.
And that was a live broadcast of a press conference hosted by the THA's Division of Health, Wellness and Family Development, giving an update on Tobago's response to the COVID-19 pandemic. Remember to stay tuned for more on TTT, Talk City 91.1 FM and TTT Live Online. I'm Stacey Ann Providence. Good afternoon.
This is TTT. Live for local.